Assalamualaikum everyone. In today's video, we are going to discuss some quick overview of all the physiology practicals of Form D first year. Okay, so the experiment number one of this experiment is the observation of vital function of which are the signs of healthy individual. So now we are going to discuss what are the vital functions, and they give you a sign that you are a healthy person. So before we are going to start the video, I request you to please subscribe to my channel, like my videos, and also press the bell icon to get the notification of all the videos which I have uploaded. Thank you so much for liking me, for subscribing to my channel. Now let's start the lecture. So first of all, the apparatus you need for this experiment, of course, the vital functions are of 6 types. First is your heart rate, your breathing rate, your oxygen saturation, your temperature, and your pulse rate, and as well as your blood pressure. Okay, so now let's discuss the heart rate first. As all of you know that heart rate is the number of beats per minute of a heart, means how many times your heart is beating in a minute. Okay, so the number of beats in a minute is called as heart rate, and the normal value of your heart rate is 72. And if you tell us the range, then the range is between 60 to 100. Now how you measure it and what is the method to measure the heart rate? So you would going to use stethoscope, and you will count the number of heartbeats of the subject and not the results. Okay, next vital function is the respiratory rate. Respiratory rate is defined as the number of breaths taken in a minute. Okay, it's called as breathing rate, and the normal breath is 25 to 28 beats per minute. Okay, so the healthy person is going to take a 25 to 85 breath in a minute. Okay, and a minute contains 60 seconds, so in 60 seconds you are going to breathe 25 to 28 times. Now how to calculate the respiratory rate? So you have to allow your subject or your patient to sit down and to relax, and then you have to count the number of breath he was taking, and then you will count it down in a minute. Okay, so you should know need a stopwatch for it, so that you could count the 1 minute. Next thing is the pulse rate. Pulse rate is very similar to the heart rate, but just difference. Heart rate is the beating of heart, but pulse rate is the beating of your arteries. Okay, so your arteries is beating due to the vibrational motion created by the heart. So this is called as pulse rate, and there are 7 pulse rate points where you can calculate it or find the pulse. So these 7 points are your foot below your knee, and your groin, your inside a portion of elbow, your abdominal part, your wrist, and your neck. These are the 7 points where pulse rate can be detected easily. Now method to find out the pulse rate is very simple. You have to place your 2 fingers over the wrist and in the artery, and then you can feel it. Now the next thing is about the blood pressure. Blood pressure is the pressure exerted by your blood onto the walls of arteries and arterioles. There are 2 types of blood pressure: systolic blood pressure and diastolic blood pressure. Systolic blood pressure is the maximum pressure which is exerted by your heart in one heartbeat, and your diastolic is the lowest blood pressure in during your heartbeat. So your cardiac cycle is actually consists of 2 pressure: systolic and diastolic pressure, and the unit to measure your blood pressure is mm of Hg. Method you will going to use it your sphygmometer and your stethoscope, and then you will find out the blood pressure. The whole procedure to determine the blood pressure is given in the next practical, so we will discuss it the whole detail of it in the next experiment. Now the other vital function is the temperature. You know, everybody has a specific temperature. The normal body temperature is of a healthy person is 96.6 degree in Fahrenheit, and 37 degree in Celsius. So the range is also given. For example, in Celsius your temperature should be 36 to 37, and in Fahrenheit it should be 97 to 99.5%. So if the whenever a person is disease, his temperature changes. Whenever it can be below, it could be above this normal range. So in that way we can detect that this person is disease or not. So you are going to measure your blood temperature with the help of thermometer. Easy, you should can place the thermometer under your arms or under the tongue, and you should get the readings. Next thing is the blood saturation level, blood oxygen saturation. It refers to the percentage of oxygen which is present in your arterial blood. Or you know that your arterial blood is oxygenated and it contains oxygen. So what percentage of oxygen is present, this is called as blood oxygen saturation, and the normal value is about 95% to 100%. And the person which have some kind of lung disease or pneumonia, they have percentage lower than the 95. So when the age increases, this level also decreases. So the method to calculate it is the oximeter, which is a device that is used to find out the blood oxygen saturation. So the middle finger and the right thumb give the accurate value of it. So this is the experiment number 2, and in this experiment we are going to determine arterial blood pressure. So what is the blood pressure? It is the lateral pressure which is exerted by your blood onto the wall of arteries and blood vessels. Okay, so it is not steady, it is constantly changing and fluctuating, and it change due to your body needs. Your body need it. Okay, so the apparatus to calculate the blood pressure can be calculated by two methods, which is can be direct and can be indirect. So direct method is calculated by the cannula and T-tube, and this is performed on the animals. But for the human being, we use indirect method by the sphygmomanometer. Okay, so now we discuss what is the arterial blood pressure. The difference between the blood pressure and arterial blood pressure. So the arterial blood pressure is the pressure which is exerted by the action of heart onto your aorta or your arteries. Okay, there is a venous blood pressure which is exerted by blood onto your veins and venules. Okay, but this arterial pressure is on your aorta and your arteries. So now it is written that it is usually help you to determine that how your what is the performance of your cardiovascular system. If your cardiovascular system has some defects, then automatically your arterial blood pressure will be affected by it. Okay, so the next thing is the types of blood pressure. There are some types of blood pressure: systolic blood pressure, diastolic, pulse pressure, and mean arterial blood pressure. So systolic blood pressure is the maximum arterial pressure during the contraction of heart, when your heart is going to contract. Always remember that the word systolic always mean contraction. So whenever your heart is going to contract, when whatever the chamber it is always systolic. So therefore we are going to say arterial systole, ventricle systole. Okay, so it is going to show that your arterium part is going to contract, your ventral part is going to contract. So your systolic blood pressure is the maximum blood pressure which show your heart contraction, and the average value of it is the 120 mm of Hg. Your systolic blood pressure is more fluctuating and constantly changes because of the heart action, and the range of it is from 110 to 130. Okay, but the normal value is 120. Next thing is the diastolic blood pressure. Diastolic blood pressure is the minimum pressure which is exerted due to the expansion of your heart. Okay, systolic blood pressure is due to the contraction of heart, and diastolic is due to the expansion of heart. It is less fluctuating, and the normal value of diastolic blood pressure is 80. Okay, and its range is from 60 to 80s. Now next thing is the pulse pressure. Pulse pressure is nothing but it is the subtraction, it is the difference between the systolic and diastolic blood pressure, and the range of pulse pressure is from 30 to 40 mm of Hg. So the formula to calculate the pulse pressure is equal to systolic minus diastolic pressure. So if your systolic blood pressure is 120 and your diastolic is 80, so whenever you are going to subtract them, you will get a value of 40 mm of Hg, which is showing your pulse pressure. Now let's discuss what is the mean arterial pressure. Mean arterial pressure is the average of your cardiac cycle or cardiac movement. Okay, so the formula to calculate is the mean arterial blood pressure is diastolic plus 1 by 3 pulse pressure. Okay, pulse pressure is 40, 1 over 3, and diastolic pressure is usually 80. When you put all of these values, you will get 100. So always the minimum value of your mean arterial pressure is 92 to 100, but always it should be 100. Okay, so it abbreviation as MAP. Okay, and responsible for the pushing of blood. Okay, Now let's discuss about the sphygmomanometer, and we see that we are going to measure blood pressure with the help of sphygmomanometer, and how we are going to measure it. So a sphygmomanometer is actually an instrument which is used to measure the blood pressure, and unit to measure it is of Hg. It has some three parts: manometer, air bulb, and cuff. Okay, so cuff is secured around your arm. Air bulb is a bulb through which you are going to compress it and through which you are going to pump the air, and manometer is a instrument which you use to find out the pressure. So these three parts are present in your sphygmomanometer. Now let's see the types of sphygmometer. There are two types: mercury sphygmomanometer and digital. Mercury sphygmometer consists of mercury, in which whenever we are going to pump, your mercury is going to high level, and then from mercury we are going to measure it, and in the digital we get the digital answers and digital values. Now we are going to discuss the method to measure the blood pressure by oscillatory method. So for this you have to ask your subject to relax and to sit on a chair and lower their arms, and after that you should have to place the cuff and tight the cuff around them, and the bronchial pulse is just above the angle of the below. Now you have to put the stethoscope just below the cuff, and then you have to listen the sounds. So these sounds are called as critograph sounds. So critograph sound is due to the scientist name given to them. There are five phases of sounds which are produced. First is the sudden appearance of faint, but this pain sign is going to increases with the time, and it increases up to the 10 mm of Hg. Then the second phase of sound will be is that your sound is going to be murmur in the next 15 mm of Hg. Okay, first suddenly you will hear a faint sound, then it gradually increases, then in the phase 2 it going to decreases in the next 15. Now in the third phase there will be again. So in the third phase, your sound is going to be louder in the next 15 mm of Hg, and in the fourth phase, your again your sound is going to muffled and murmur in the 5 to 6 Hg, and in the fifth phase, your completely silence is occur. You will hear no sound. Okay, so these are the five phases in which you are hearing these sounds, and by these sounds, you are going to detect what is your blood pressure. So in the phase 3, when you hear a large sound, this is going to detect your systolic blood pressure, and in the last fifth phase, when you hear completely sound silence, then you will hear your diastolic blood pressure, okay, value. So there are some precautions of it. For example, you should find out the zero error. You should not tightly pack your cuff, and the muscle of arm should not be contracted. So these are some precautions. Now let's see the experiment number 3. So in the experiment number 3, we have to determine the bleeding time of a body by a Duke method. Okay, so for this method, you have to take filter paper, spirit swab, spirit a lamp, a sterilized lancet, and then stopwatch. So bleeding time is the time interval between the appearance of your first drop to the last drop of the blood. Okay, so time interval between the appearance of first drop to the last drop is called as bleeding time. Normal range is 2 to 6 minutes. Okay, so significance is that it is going to detect some kind of defects in your blood vessels, and your defects in your platelet segregation, another kind of disease, for example thalassemia, thrombocytosis. Okay, so these kind of diseases should be easily diagnosed by bleeding time measurement. So the procedure of this experiment is that you should clean your finger with the spirit swab, and then you have to puncture the fingertip with the help of sterilized lancet and give a deep cut to 3 millimeter. Then you have to start the stopwatch, and after 60 seconds you have to place this finger onto the filter paper. After that you again start your stopwatch till up to the 60 seconds, and after that you have to place another drop, and you have to repeat this procedure till up you have no spots available appear on the filter paper, and after that you will count at what time taken and what drops are appear. So first drop appear at the after 30 seconds, then other drop after appear after more 30 seconds. So the 30 plus 30, it will be give you 60 seconds. So it's mean that your bleeding time is 60 seconds, which is normal. So in that case you will find out what is your bleeding time. Now there is another experiment. In this method we are calculating blood clotting by the capillary method. So in this method you will going to take a capillary tube. So again you will define what is the blood clotting time. So it is time required between the appearance of first drop till up to the appearance of last drop. Okay. Significance is detecting your hemophilia, liver diseases, thrombocytopenia. So these kind of diseases should be detected by it. Procedure of this experiment is very simple. You have to again cut your finger, and with the help of lancet and in the aseptic conditions, and after that you have to wipe away the first drop of blood, and then you have to fill your capillary tube, place your capillary tube horizontal, and then your blood is going to suck into the capillary tube. And after that you have to and one thing you have to keep in mind, that there should no formation of bubbles in it. And then you have to after 1 minute you have to break the capillary tube, and you have to observe some thread like appearance in it. Actually thread like appearance, it will be going to detect where blood is going to coagulate. And after every 1 minute you have to see, and you have to find out whether the thread is appeared or not. Okay. And when the thread is appeared, you will going to end up your procedure. And if the thread is not detecting, then repeat this procedure every time. So the average time of clotting will be your 2 to 6 minutes. And precaution is that you should know there should not be formation of air bubbles, and there should not be a deep cut. And don't end the close the end of the tube, and use your own lancet and break it after the use. Now we are going to see what is the effect of posture on the blood pressure. Okay, so your position is creating a lot of effect on your blood pressure. For example, if you are laying down and you are in a sleepy position, then your blood pressure is very low. And if you are standing up, your blood pressure is the highest. So there is the difference whenever you are sitting, you are laying down, and you are standing up. So in these three positions your blood pressure is going to be different. So now we are going to see how the pressure is going to affect it. So first you have to immediately change the position from laying to standing, and then after 20 seconds you have to, because it is happened because venous pooling. Okay, all of your blood is going to be your in lower part, and due to this there is low venous return and low cardiac output. Then your baroreceptors detect that there is a low blood pressure, and after that it is going to be increase the sympathetic discharge. Due to it your heart rate increase, again your force of contraction and your peripheral resistance increases, and your blood pressure increases. So all of these compensatory changes increase your blood pressure and raise in the systolic. Okay. So after 30 seconds you have to find it out. What is the procedure is that you should use oscillatory method to determine the blood pressure. You should have asked the object to first lay in the spine position. Spine position is actually your sleeping position, and after that you have to record it. After 1 minute you have to ask your subject to sit properly, and then after you will find it the blood pressure and note down the values. And after third time you ask your subject to stand up, and after standing up you will find again the blood pressure, and then you have to write it down, and you will clearly observe that how your blood pressure change by your changing posture. And the precautions of this experiment is given, and this there is no difficulty in it. Now, in the experiment number 6, we are going to see how the exercise is going to affect your blood pressure. Your exercise is going to greatly affect on it. So, it is very important to know the severity of exercise, whether you are going a soft exercise, mild exercise, and a severe exercise. So, it depends. And because whenever you are going to exercise, your oxygen consumption is gradually increases, and due to more and more oxygen consumption, your the value of oxygen in your body is decreasing. So therefore your heart rate as well as your breathing rate is going to be increases. So exercise has effect on your pulse rate, your heart rate. Okay, so now we see how it is going to affect it. So the change in the blood pressure depend upon your size, exercise nature. During isotonic exercise, mean mild exercise, there is increase in systolic blood pressure as well as in diastolic blood pressure in all grades. During the isotonic exercise, effect on the blood pressure varies with the severity of exercise. During moderate exercise, more rise in the systolic blood pressure and no change in the diastolic blood pressure. In heavy exercise, there is further rise in the systolic blood pressure and no and slightly fall in the diastolic blood pressure. So your BP is normal in the mild exercise, then your BP increases after the mild or heavy exercise, and then BP after the moderate. So BP have to come when you have blood pressure have to come take 5 to 7 minutes to return back to its normal value. So this was this experiment. Now we move on to the experiment number 7. So in the experiment number 7, you are going to determine your blood group. Okay, so first type of blood group is the ABO blood groups. So ABO blood group is an inherited character because it is going to inherit it from parents to their child and offspring. So it is type of blood group which is principally is due to the presence and absence of the antigens. There are 4 types of antigen: antigen A, B, AB and O. Okay, they are present on the surface of RBC, and due to their presence they are going to determine what kind of antibody is it. So the antibody is according to the antigen. For example, antigen A contain antibody B, antigen B contain antibody A, antigen A B contain no antibodies, and antigen O contain both anti A and anti B antibodies. Okay, so there is a anti-serum A and anti-serum B, which react with the specific type of antibody and form the clot. Okay, now we see what are the apparatus for it. You should need a glass, right? You should need anti-serums of A and B, lancet, spirit swab, toothpick, marker and tissue paper. So in the procedure, you have to took a clean a microscopic slide and mark the two sides with the A portion, B portion. So after sliding them, you have to prick to your finger and you have to place the drops of your blood onto this slide, and after that you have to put the anti-sera A and anti-sera B in both of these blood groups, and after that you have to mix them with the separate mixing spatula, and after that you have to wait for the some time, and after some time agglutination will going to be occur, and where part agglutination is occur, you will find out your blood pressure blood group. For example, if the blood coagulate by adding the anti-sera A, it means your blood group is A, and if the agglutination occur by adding the anti-serum B, then it means your blood pressure, your blood group is B. And if in agglutination is occurring in the both A and B part, then it means your blood pressure your blood group is AB both. And if there is no agglutination both in A and B portion, it means your blood pressure, your blood group is O. Okay, so now we discuss what is the RH blood group. So this is the experiment number 8, and now you are going to detect what is the RH factor. So the RH system is greatly very important, and it take its name from the rhesus monkey because it's first discovered in a rhesus monkey. So therefore it is given name. It composed of 3 antigens, C, D and E, but majorly D is responsible for it. So the ABO blood group antigen system has not been detecting. So D is most antigenic compound, and if the antigen contain D, then it means it is Rh positive, and it doesn't contain it means it is Rh negative. So Rh negative individual has no D antigen and Rh and form a anti-D agglutination. So this now moving on to the next page. So the procedure is very similar to the previous experiment, and just the difference of anti D serum. Okay, so in the previous experiment we have took the serum which is anti A and anti B serum, but in this experiment we took anti D serum and we mix it, and after that if the agglutination occur, it means you are Rh positive.